Brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. This is as usual, this is a series of lectures that we've prepared for you, just purely to prepare you emotionally and mentally and spiritually for Hajj. Each day or each seminar, we're getting a different lecturer to do the seminar, and they cover a specific aspect of Hajj, which is quite important. We've broken it down in this order, not necessarily order, but in these particular subjects to give you that a detailed knowledge of what you need and just to prepare you for Hajj. Now, our learning portal is available from the website, which is hunafa.com. There you'll find everything you need to know from A to Z, even the medical advice, it's there, inshallah. We did promise to upload all the lectures into our portal, but due to a technical fault, we've not been able to do that. But these lectures are available on YouTube. So under the Hunafa homepage, you will find these lectures there, inshallah. Now, the subject of Hadi, I know I've been covering this almost every seminar, but I have to say this because just for people who have missed out or who haven't heard the information. So the issue with the Hadi is we've sent you a link on the WhatsApp group. If you wanted to do it with us, then by all means, please fill up that link and then pay on that link, and then we'll sort out your Hadi. Now, the issue is if you've done it with Nusuk, again, it's not a problem. The Qurbani, it's not a problem. The issue is on the day, on the 10th of Dhul Hijjah, when we are required to come out of Ihram. It's going to be a very busy day, and you've been on the Ihram for almost a couple of days. If you've done it with us, if you've done the Hadi with us, we have the information at hand, and we should be able to tell you straight away, and you'll be able to come out of Ihram. Once it's out of our hand, like you've done it with Nusuk, this may take a little bit longer because their process is a little bit unclear at this stage. It may not be, but it could also be as well. I am positive that I'm sure that they probably won't be able to communicate with you by your text message or give you a call or something like that. They probably will email you, and it could potentially take a little bit longer. So on that day, you may have to wait a couple of hours before you can come out of Ihram. But it's not a problem. If you've done it with Nusuk, inshallah, everything should be fine. But if you wanted to do it with us, the link is on the WhatsApp group, and please use the link to pay for your Hadi. Now, in terms of the question and answers, again, like the most other seminars, if you can limit it to the subject that we're covering today, it will be good. Purely because we don't want to answer any logistical questions because it will confuse people, because there are people here from various packages and also people from worldwide as well. And also anything relating to the Hajj rites, we have a dedicated seminar for that. If you can just hold on and ask the questions in that particular seminar. Now, today we have with us Dr. Saud, a dear brother, Dr. Saud, who's got 20 years clinical experience as a GP. He's worked in the A&E department, and he's traveled for Hajj and Umrah many times to Saudi. And he's also been a medical guide with us on a previous tour. And I believe, Dr. Saud, you're still living in the Middle East, in Medina, I believe.
Alhamdulillah. Alhamdulillah. I've been living here for the last 2.5 years, inshallah.
20 years. Alhamdulillah. So without any further ado, I can hand over the floor to you, Dr. Saud.
Jazakallah khair. Share my screen. Oh, do you mind just enabling the sharing of my screen?
Sorry, yes, I will do.
Yeah. So while we're doing that, inshallah, so this is going to be a brief kind of talk. I'll try and make it about 20 minutes, inshallah, and then give some time for questions at the end. And it's just some advice, general tips. So, if you have any questions at the end, please feel free to ask. As was mentioned, alhamdulillah, I've been with Hunafa Travel before as a doctor, so I know kind of what it entails. I've been separately as well as just as a pilgrim. So inshallah, I hope I'll be able to provide you some kind of information as to what to expect from a medical point of view, inshallah. Brother Said, if you can't enable it, then if you can share the presentation from your side, and then we can just go through it from there, if that's or I think I'm the host.
Should be able to do it now.
Yeah. Okay. So let's have a look. Can you see the presentation?
Yes, I can.
Okay, brilliant. Wassalatu wassalamu ala rasulillah wa ala alihi wa sahbihi ajma'in. Bismillah. So yeah, so the context of what we are going to cover today will be about pre-Hajj health status, general recommendations in terms of how to prepare for going on the Hajj, issues regarding chronic illnesses, chronic disease, some of the things that you can possibly expect. Inshallah, you'll all be fine, but some common problems such as foot issues, blisters, respiratory illnesses, food poisoning, heat-related illnesses, because it will be pretty hot, and just some advice about how to pace yourself through the few weeks that you'll be there, inshallah. So in terms of pre-Hajj health status, so I mean, if I don't know if any of you have done Umrah before or have even done Hajj before, but Hajj is physically quite taxing. Okay, there will be a lot of walking involved, and so the Saudi Ministry of Health actually advised the following groups of people to postpone or reconsider their Hajj travels. Okay, this doesn't mean that you can't do Hajj if you're in any of these categories, but you really need to think carefully as to whether it's appropriate for you to go at this point. So those are the over 65s, women who are currently pregnant, children under the age of 12, those people suffering from chronic illnesses such as heart disease, kidney disease, respiratory issues, diabetes, anyone with the immune deficiency problems. So if their general kind of immunity is low, okay, and people who have cancer and other terminal illnesses. Okay, so we do recommend if anyone falls into one of these categories that you think carefully as to whether you'll be able to fulfill the rites of Hajj, from a physical point of view, because you may find that a person's health will deteriorate whilst out there. In terms of preparing for Hajj, so a really important question to ask is your exercise tolerance at the moment. So when I say exercise tolerance, how much exercise you're able to do on a normal day. If we are someone who is really not doing much physical activity at the moment, not doing any exercise, then when it comes to Hajj, and when we suddenly find that we're going to have to be walking quite a lot, quite often in the heat, when you're already going to be tired, and the rites of Hajj are going to be lasting for several days, then it's really important to think, how can we prepare ourselves to be able to deal with that? And then also, what is my diet at the moment? So it's really kind of basic healthy lifestyle issues. So in order to prepare, to prepare yourself as well as you can from a physical point of view, just some basic tips that I have now. To start drinking at least about 2 liters of water a day. Okay, that's the bare minimum. So in a hot country such as Saudi, it's going to be quite hot when you come. Temperature in the daytime may easily be touching kind of 35 to 40 degrees centigrade. So I think it's a good habit to get into now, to start drinking lots of water, to reduce the consumption of caffeinated beverages, tea, coffee, fizzy drinks. I think tea or coffee maybe once or twice fine, but if you're having a lot of that a day, then it's a good idea to start cutting down now. And just generally eating healthily, I think we don't really need any major information about that, but having lots of fruit and vegetables to your diet, that will obviously make you generally healthier, but also things like making sure it's easy for you in terms of your bowel habit, not to get constipated. It may sound like something a bit awkward to talk about, but when you're out of your comfort zone for several days, and we're not eating normal foods that we're used to, things like that can have an impact on, how comfortable we will feel during those days. Okay. So generally kind of trying to eat healthily, drink lots of fluid, and cutting out unhealthy foods. So if we can start doing that now, that would be really good. Also some other tips: reducing the size of your meals, having more smaller meals during the day instead of having large meals, especially late at night. And then in terms of walking, I think this would be really important. This is one way to increase our exercise tolerance, our ability to be able to walk longer distances. So if you can start walking at least 30 to 45 minutes every day now, that will, kind of when you come and start doing the rites of Hajj, you will find the physical exertion a lot easier. And if you are able to, what would be even better is to actually do some exercise. So that 30 to 45 minutes a day, it's kind of just normal walking. Okay, that's useful, but exercise would be even better. What do I mean by exercise? So something where you're really breathing hard. So whether that's like jogging, running, cycling, swimming, and there's something called high intensity interval training workouts, whereby you go as, for example, you run as fast as you can for a minute, then you stop for 30 seconds for a minute, and then you do the same again, run as fast as you can for a minute, and you do that repeatedly, over about 5 or 10 minutes. And researchers showed that these HIIT workouts has similar beneficial effects to the body, just as if you were running straight, for 30 minutes continuously. So this is really depending on your exercise tolerance now, and also your general state of health. And if you have any medical problems, such as if a person does have heart disease, high blood pressure, things like this, then you have to be careful. Then I wouldn't recommend that. Then I think, maybe a good idea to speak to your GP or family medicine doctor before you start embarking on that. But as a general rule, to try and do more physical activity now in the weeks leading up to Hajj is a very good thing. Okay.
Start exercise.
Sorry, I think someone's mic is on there. So some other tips I would recommend. So I don't know if there are people joining us from America. So when we mention GP here, GP just means your family medicine doctor. So I would advise, if you do have any medical problems, any chronic medical problems, it really would be a good idea to see your family medicine doctor, to see your GP several weeks before leaving, just for a medical review. Because, it's one thing me giving you giving you advice here, but, I don't know each of your medical history. So there may be things that are pertinent, that are, relevant to you as a person, that I cannot really give you advice about. So that you need to get from your own physician, okay? So I think that would be a sensible move. If you do have any medical problems, please get a medical summary printout that includes your medical history, includes any medication that you're taking. And if you are going to be taking medication to Saudi, then I definitely recommend that you get a letter from your GP detailing the medication that you're carrying, okay? I do remember when I was coming, either it was in Hajj or was just visiting the country, that I had some medication with me that I was keeping, that I brought in the baggage, and customs stopped me at the airport and asked me, what are you doing with this? Because especially if you have controlled drugs like codeine, tramadol, and maybe even insulin and so on, you have to be really careful, because the laws here regarding even medication is quite strict. So you don't want to be having a problem at the airport and so on. So please, get a letter from your GP saying that you need these medications and that you need to be carrying them. Okay. And if you do need medication, request it from your family medicine doctor, a couple of weeks before you leave, just so that you're going to get it in time. You may not find all the same medication that you need in Saudi, so it's probably better if it's important medication that you need to take every day or regularly. It's a good idea to bring it with you, okay, and keep it in your hand luggage. And there are certain medicines that need to be refrigerated, so that's something you need to bear in mind. If you're on medicines such as blood pressure medicines, asthma medicines, medicines for any heart problems and so on, it's very important that you continue to take the medication. Please don't stop taking the medication. It's really important that you continue. If you are someone who maybe mobility is an issue, or if you have chronic illnesses such as heart disease, then you can make use of a wheelchair. In certain times, if you're feeling really tired, or you feel you can't do it, then you can make use of a wheelchair or other concessions. So don't overburden yourself. Okay. And as I said, lastly, any emergency medication that you need, as for example, if you're an asthmatic, if you have any heart illnesses, make sure you have those emergency medicines, which I'm sure you'll know by now anyway, which ones you need to take. Okay. Regarding women's health, for women who want to think about delaying their period so that they don't get it during the days of Hajj, then it may be worth speaking to their GP or to their family medicine physician. It's an option for them to take medication to delay their menses. But normally you should probably be better to start that medication before you come. So I would say, without going into great detail, I think speak to your GP about that. Okay, speak to your GP about that. Be sensible to bring some basic painkillers with you, such as paracetamol or ibuprofen. Okay. As I said to you before, codeine here is a restricted drug, tramadol even more so. So be careful if you're bringing those medicines. But paracetamol, a small box of paracetamol, Panadol, or ibuprofen should be a problem. You can get that here as well, but I think it's always a good idea to have a small box with you. In terms of if you do have any medical problems already, ideally, really, I'm not in the best position to give you advice because I don't know anyone's medical history. So really, I don't want to be giving advice which may in fact turn out to be wrong. Okay, that's why I said before it's really important that if you do have any chronic medical illnesses, that you speak to your own family physician. Okay, so some of the things, inshallah, you'll all be fine. But sometimes, in terms of foot problems. So obviously, you're going to be doing a lot of walking. And so it's really important to get good quality footwear that you've broken into. I don't think it's a good idea to buy new shoes or sandals and you start wearing them for the first time when you come on Hajj, because as we all know, when you start wearing shoes or sandals for the first time, it will take some time for them to fit you properly. So you don't want to start getting any sores or blisters, because of that. So, if you get a comfortable pair of sandals, footwear before coming, I think that's sensible. Also, once again, if you try and start walking longer distances just to prepare yourself, that helps. So, blisters, unfortunately, are relatively common. So if you do get any blisters, generally it's a good idea to pay close attention to try and keep the blisters clean. We don't normally recommend that you pop them, but if there are any signs of infection, or if a person has diabetes, then that is really important. That is really monitored closely, and I think it would be sensible to show a doctor if there is any sign of infection, or if you're a diabetic and you start getting blisters on your feet. Okay. And then the third point, just what I've already mentioned. Really important to take care of your feet and check them regularly, moisturize them daily, especially if the skin becomes dry, then that becomes more prone to cracking, and that's also when it can become infected. So moisturizing regularly, keeping the skin soft is really important. Avoid walking barefoot as well. If you are sitting for long periods, which may happen sometimes, maybe while you're waiting for transport and so on, it's always a good idea to move your legs regularly, or maybe just get up and take a short walk just to prevent any blood clots. In terms of respiratory illnesses, these are also quite common. Almost everyone gets cough, runny nose whilst you're out there. To reduce the risk of developing a cough, sensible precautions, washing your hands frequently, using disposable tissues when you're blowing your nose, cleaning your face, trying to minimize exposure to people who are already affected. You should have got your flu vaccination by now. In Saudi anyway, I mean, there are 3 mandatory vaccinations. I'm not sure what the prerequisites for you all are coming from abroad, but in Saudi, if anyone wants to go on Hajj, they need to be up to date with the flu vaccination, with the COVID-19, and with meningitis. So I think those 3 vaccinations are probably obligatory for you to be able to come. But just double check that. I'm not sure of the requirements from your side. If a person does have any respiratory problems like asthma, then it's really important to have that under control before you come out, especially when you come out to an environment like this, which is dusty. That can really make respiratory conditions worse and cause a flare-up. So it's really important that you try and have the symptoms under control before coming. Okay. Food poisoning, unfortunately, is also quite common. And so to reduce the risk of getting food poisoning, simple tips: washing your hands before meals and after using the toilet, eating cooked food, drinking bottled water or mineral water, avoiding fresh salads, eating fruits that have a thick peel, such as bananas and oranges, okay? And then drinking milk that you ensure is pasteurized, okay, safe to drink. In terms of the heat, as I said, already in Makkah and Medina, the temperature is hitting about 35, almost 40 degrees centigrade. So, next month, it's likely to be a few degrees hotter. So in order to reduce the risk of heat-related illnesses, sensible precautions would be, as I said, drinking lots of water, 2, if not 3 liters of water, especially in a hot climate. Then applying sun cream. Now, you just need to make sure that from the fiqh point of view that it's allowed. So maybe a good idea to ask your guide whether you're allowed to apply the sunscreen that you have there, okay? But certainly when you're not in ihram, then obviously that would be a sensible option. Avoiding, long exposure to direct sunlight, using an umbrella when possible. And you may also want to wear sunglasses. So symptoms of heat exhaustion include dizziness, headache, vomiting, muscle cramps. But if you're feeling unwell in any way, I think it would be sensible, to seek medical advice, wherever you are. And I'm not sure how long some of your packages are going to be, but if anyone is coming kind of more than 2 weeks before the rites of Hajj start, then obviously, mashallah, it's an amazing trip, and the longer the better. But I think it's just sensible to kind of pace yourself. What people don't realize is that actually just being in and around the haram, whether it's in Makkah or Medina, and going for your 5 daily prayers, because obviously when you're in Makkah and Medina, in Makkah, as you know, the reward for one obligatory salah in the masjid is 100,000 times more than in a mosque outside of Makkah and Medina. And the reward for the obligatory salah in the haram in Medina is 1,000 times more than any other normal mosque. So when you're here, for the days that you're here, really, you don't want to be missing any prayers in the masjid, okay? But it's actually quite tiring, even just going for the 5 daily prayers. People don't realize there's actually a lot of walking to do. Even if you have a hotel on the doorstep of the haram, even the closest hotel, you're going to end up doing a lot more walking than you normally do, and it can get quite tiring. So just I'd say pace yourself. I think try and pray the 5 obligatory prayers definitely in the masajid. But apart from that, I think sometimes it's just wise to kind of to chill, not to exert yourself too much, because when it comes to Hajj, you really want to be going all out and having a lot of energy, to be able to enjoy the days of Hajj, and especially Yawm Arafah, to be making lots of dua. So you really need to have, high energy levels to be able to enjoy those days. Okay. So yeah, that's really it. Quite a basic talk. I hope it's useful. And if you have any questions, please feel free to ask.
Assalamu alaikum.
Walaikum salam.
Yes, I have one question. My wife has high blood pressure. Does she get it from the doctor?
So you said your wife has high blood pressure? I didn't hear the bit after that.
Yeah, she has a high blood pressure. Does she need a letter from a doctor that she's
Letter from the doctor? I would advise yes. I would just say get a brief letter, or if not even a letter, maybe just a medical report or a medical printout, just to say that it says on there that she's suffering from high blood pressure and that she's taking these medications. I think it's just better to be safe than sorry. You just don't want any issues at the airport. And also, I think it's just a good idea to keep, some basic medical records on you. Inshallah, she'll be completely fine. But I think it's always sensible to have, to have a list of the medication, that she's taking with her. Yeah.
One more question, if you don't mind, from Toronto, Canada. And are we covered for like medicines and general health insurance and so on, or do I need to buy it from here?
It's a good question. I don't know.
Yes.
Said, do you know the answer to that?
Yes, for general medication, you are covered as part of the Hajj.
Okay. All right. Just want to know. Actually, we're fine, but just in case if we have an injury, for say, or something else, like if you need to go to the hospital, do I need to buy insurance? That's what I wanted to make sure.
No. Inshallah, you're covered for that. Your Hajj package covers you for that. And alhamdulillah, in Saudi, when we go out for Hajj, they're actually very good. Medically, they're very good. They look after the pilgrims.
Okay, excellent. Thank you so much. Jazakallah khair. Assalamu alaikum.
Assalamu alaikum.
There's a couple of questions on the chat. Okay, brother, if you want to ask, we can come back to the chat. Go ahead.
Can I ask a doctor, and can I bring antibiotics with my name on it, and also Imodium for diarrhea or something like that?
Inshallah, I think that's fine. I think don't overdo it. I think maybe 1 or 2 packets of antibiotics. I think that should be enough, because you can get antibiotics here as well. Normally at the pharmacies you will need a prescription, but as Sayyid Bai says, the medical services here are generally quite good. It's free for pilgrims. So if you did need medication or antibiotics, they would also give it to you. But I think if you wanted to keep one course or 2 courses, I think that's fine.
And Imodium also for diarrhea.
Imodium, inshallah, that's fine.
Jazakumullah, doctor.
Oh, yeah.
First question in the chat, Dr. Saud, is what are the best ways of staying hydrated?
Yeah, I think just having fluids regularly, to be honest. I think having regular amount of fluids, if you're going to be going out for a long walk, I think, keep a bottle of water with you. Generally you'll always be able to find fluids, wherever you're going. But I remember, obviously, for the stoning, the Jamarat, depending on where your camps are, the walk to the Jamarat may be quite long, and depending on what time of the day you go, it's going to be quite hot. So it would be sensible to keep, a large bottle of water with you. Drinking also throughout, when you're not doing any exertion, it just generally keeps you well hydrated. So, and then, avoiding spending long periods of time in the sun if you can. So kind of simple things, really. Yeah, I don't think there's anything special as such that you need to do. There's another question here from Ijaz. Assalamu alaikum, wa alaikum assalam. If somebody gets an ankle fracture, doctors asked him to wear a medical boot on one foot. Is it permissible to do Umrah and Hajj with that boot? I think this is a question more from someone who's a scholar rather than me. I think it's more of a fiqh question. So I don't know, maybe if you can answer.
Yeah. Inshallah, we will make a note of that, or if the brother could ask again when we do the Hajj rites, and the Sheikh will be able to answer that.
Okay. So sister's asking, would you recommend electrolytes in water? I guess, yeah, I don't think there's any harm in doing that. I don't think there's any harm in doing that. I think you can get drinks from the pharmacy or maybe even from the supermarket. But I don't think it's something that you really, you definitely need. I think water would also be sufficient, but I think electrolytes in water is also fine, inshallah. How much in advance should the tablets for menstruation be taken in order for it to be most effective, and when should I stop taking them? Okay. So firstly, you need to make sure that you don't have any contraindications or any reasons why you can't take those tablets. There are some medical illnesses which would mean that you shouldn't take those tablets, okay? Sometimes those tablets that are used to delay the menses can increase the risk of blood clots. So if someone has a tendency to get blood clots or have a history of blood clots, then they shouldn't be taking them. Okay, so that's something that really you need to speak to your GP or family medicine doctor about. But as a general rule, you should start taking the tablets at least a few days, either before you expect the start of your menses or before, you are, say, for example, going into ihram, okay? And in terms of when you should stop taking them, well, you can expect that when you stop taking the tablets, many women will start getting their menses immediately. So, if you're still in ihram, then, I would not recommend that you stop taking the medication. You should, because once you stop the medication, the likelihood is that, a person will start menstruating, okay? Apart from the considerations you mentioned, what would you advise someone who will be 13 weeks pregnant during Hajj? Assuming there are no medical issues, example, continue to use the restroom, mistake wudu for tawaf. What would you recommend? Okay. So if someone is pregnant, well, as you know, first 3 months, they should be taking folic acid anyway. So that should already be a given. Otherwise, in terms of being able to use the restroom, it's a bit of a tricky one, to be honest. I think you need to be stating wudu for tawaf. I mean, I wouldn't be worried about tawaf. Alhamdulillah, I just recently went on Umrah, and tawaf, even if you go on the first floor, which is a much longer way around, you should be able to do tawaf really within 1 hour, to be honest, within 1 hour. And if you go in the mataf area, which is right next to the Kaaba, or on the ground floor, then depending on how busy it is, you may be able to do it within about 40 minutes. So I think inshallah, for 1 hour, someone should be able to keep their wudu. If they're not able to keep their wudu even for that amount of time, then I think that's something that you should ask a scholar, from a fiqh point of view. If there's really a necessity or they really medically cannot keep their wudu, then I think maybe inshallah there's a concession with that. So maybe it's best you ask someone of knowledge. But inshallah, normally, tawaf, it shouldn't really take an hour max. And if someone really has mobility issues for whatever reason, then you can hire either a wheelchair, like a normal wheelchair, someone can put you around, and they do also have electric carts, okay, to do that. You can do tawaf on, then you can do sa'i on as well. Obviously, if a person can walk, then they should. But if they're really struggling for whatever reason, then that is also an option that is available. Okay, but otherwise, in terms of pregnancy, I wouldn't really advise anything really different. If you're definitely keen and want to go ahead, I certainly would make sure that there haven't been any problems in the pregnancy thus far. If you're going to be 13 weeks pregnant during the Hajj, then you should have had your 12-week scan already, or at least one scan. So I think that would be a good idea to have the first ultrasound scan to make sure there aren't any problems with the pregnancy. And so if that scan is normal, that's reassuring. And if a person gets any significant abdominal pain or bleeding, then really they should speak to a doctor immediately. Okay. But otherwise, I wouldn't really recommend any additional supplements apart from folic acid. I hope that answers the question. Anyone have any other questions?
So, doctor, there will be no problem with antibiotics at the airport.
No, it shouldn't be. It shouldn't be. I don't think so.
Beginning of your presentation, you mentioned it. Bring it an airport. You might have a problem if you bring blood pressure medication or diabetes medication, insulin or something like that.
Yeah, I think. Look, I think if you're taking
Dose of antibiotics.
Yeah, I mean, there are certain medicines that are controlled, that are restricted, and that a person would likely get in trouble if if they don't have good evidence. So restricted painkillers, codeine, tramadol, things like that. That I would say you definitely need to have clear indication from your GP and a letter to say that you need these medications.
The purpose you use.
Blood pressure medicine, yeah, regarding blood pressure medicines, tablets for any heart problems and so on, then I think just having at least a medical summary, even if it's not a doctor's letter, such just a medical summary, a printout of your medical history, I think inshallah that would be enough. For the antibiotics, if you can get some sort of letter or from the GP, I think that would be sensible. Honestly, antibiotics, I don't think, unless you bring several packs.
No,
really,
it's only 1 week dose or something like that.
Yeah, I think really, inshallah, I don't think that there
Inshallah,
really
will be okay. Jazakumullah khair, Dr.
Yeah.
Jazakumullah.
Yeah, welcome. So, is there any particular medication to take with us? As I mentioned, just maybe some paracetamol, a box of paracetamol, or ibuprofen. I think really that's probably, if you don't have any other chronic illnesses, that should be enough. Inshallah. Yeah. So I don't think there doesn't seem as though anyone has any other questions, which is great. What I would say is, inshallah, I mean, I don't want to scare anyone. I'm sure, inshallah, everything will be fine. I think, you should really look forward to going, not be worried about how you're going to manage, not be worried about the heat, even though it will be hot. I think, inshallah, the barakah, just making sure your intention is correct, to please Allah. Whatever difficulties you do go through, inshallah, Allah will reward you for that. And I think, mashallah, congratulations to everyone who is registered. I hope, inshallah, Allah accepts your ibadah, and I'm sure you will, inshallah, really enjoy it.
Jazakumullah khair. Thank you, doctor. Is that it?
I think so.
Unless you want
any other questions, Said bhai?
No, I asked my question, doctor. Thank you.
Yeah, if there's anybody else, we've still got time. Still got 15 minutes. Inshallah, if anybody else has got any other questions, please ask away or ask your questions in the chat.
Just
Welcome.
one more question, if you don't mind.
Mm-hmm.
Sure.
Just I spoke to you earlier regarding my wife's high blood pressure tablet. Doctor's on vacation now. She prescribed. Is it okay if we put in the other luggage bag? Not the hand luggage.
Okay, so I think the only thing with putting it in the checked-in baggage is that there's obviously always a risk that the checked-in baggage can go missing. So you just have to be careful that if that bag goes missing in the worst-case scenario, then would she be able to manage? So number one, would the same medication be available in Saudi? Not all the medications are available here.
Okay.
And certainly I would say at least keep medication enough for a week in the hand luggage, so that if anything goes missing from the checked-in bag, then at least you have some time in which to find a replacement or a substitute. So certainly I would always say keep at least a few days worth of medication with you.
Inshallah. Jazakallah. Jazakallah khairan, doctor. Jazakallah, brother.
Yeah,
Ahmed, you got your hands up?
Assalamu alaikum. Hope all is well. So I joined slightly late, so apologies about that. I just wanted to quickly ask regarding the vaccinations required to go to Hajj, inshallah. Now, me personally, I'm sort of like slightly anti-vac. I don't really like or promote vaccines at all. So, which vaccines do you actually need for Hajj, and is there any ways around it?
Sayyid Bhai, so okay, so either did you have specific information regarding this?
Yes, the meningitis injection is highly recommended that we do that. Other than if the brother, if you're referring to the COVID vaccination, then that's not required anymore. But in terms of the meningitis, that's been going on for forever, really, and I think it's advisable that you should take the meningitis one.
Okay, so you know the meningitis one. Is that like what is it for? Sorry, do you guys know like what it's for to like prevent basically?
Yes, so it prevents meningitis. Meningitis, I mean, if you don't know, it's just an inflammation of the layer that covers the brain. And, that is a very serious, can be life-threatening illness. So I would definitely highly recommend that you do take that vaccination at least. That vaccination, if you've had it before, depending on the strain, it should be valid for 5 years. So you should just bring your vaccination proof if you've had it before. But that's definitely a highly recommended one. So I'm based in Saudi. From Saudi, if you want to go on Hajj, they require meningitis, flu, and COVID. But as Sayyid Bhai says, I think Sayyid Bhai, you said that for foreigners, any people coming from outside Saudi, they only need meningitis. Is that right? Or it's
that's right. That's right. Especially from the UK, there is not a requirement for us to take the COVID vaccination.
Okay.
Okay. Thank you, Zaid.
Okay. Because I was just a bit like, for example, I was thinking to myself, if you are required to take it every 5 years, then how comes in the UK not everyone has it every 5 years? I was just thinking, what's the difference between here and there, if that makes sense?
Yeah, so meningitis is part of the UK immunization schedule. They do normally give it. I can't remember at what age, but they do normally give it, I think, to children of school age. There are different meningitis vaccinations, but I think also you have to think about, even if it's not obligatory in the UK, when you come to a place such as, when you're doing Hajj, you're getting people, huge numbers of people coming from different parts of the world. They're going in, they're mingling a lot in cramped areas. So, obviously it does mean that infections are more likely to spread. So, the risk of getting an infection when a person is on Hajj is much higher than the risk of getting an infection, when you're living normally in your home country. So that's why, in situations such as these, they'd make it obligatory. Whereas maybe normally, if you didn't travel outside of your home, then it may not be required to take. So it's really dependent on the situation and the increased risk.
Okay, thank you so much. Thank you.
No worries. So someone's asked, I use 2 eye drops. Do I need to get a letter from the GP? Look, I mean, I don't know whether, I'll be honest with you, in Saudi, sometimes there are rules, but it's not really implemented. You'll find on one day it's implemented and another day it's not implemented. So, and I think it's just sensible to be prepared for the worst case scenario. So even though, eye drops, I think it's unlikely to be a problem, but I think it's not only just because you don't want a problem at the airport, but also, if something happens, then it's always a good idea to have the name of the medication that you're taking. If you lose your medication, then, some of these eye drops, even I get confused. So I think it's a good idea at least to have that, as a PDF on your phone, or, print out in your hand luggage. So if you need to buy a new one from the pharmacy, at least you know the name, right? So I think, just be prepared. I think it should be quite easy to get a medical printout summary from your GP. So, just I would advise you to get at least a medical summary from the GP, if not a letter. So someone has asked, first new dose of medication is to start on 19th of June. It's infliximab, but it needs to be stored in a fridge. Will we have access to a small fridge in Mina? Sayyid Bhai, will there be a fridge in Mina?
It's hard to say, not knowing what will be in the Mina tents. I can't say for sure at this stage that if we'll have fridge or not.